Hi, this is Jessica DaMassa with WTF Health, and I am here at Bayer's G4A Accelerator launch in NYC. I have with me right now Dakota Odell. He is the founder and CTO of a company called VitaScan, and he's got a 3D printed prototype of his VitaScanner, which dramatically brings down the cost of testing for vitamin deficiencies. Is that right?
Yeah, that's correct.
So tell me a little bit about this. How does this
Sure. So what we're building at VitaScan is a portable system for measuring your vitamin levels. The idea is you could have one of these at home, you test your iron levels, vitamin A levels, vitamin B12, folate, whole nutritional panel. Right now, it's very difficult to do that. You have to go to your doctor. It takes a lot of money. They need specialized equipment. It takes a week to get results back. With a system like this, you just take one drop of blood from your own fingertip and you get results back in 10 minutes.
Oh, wow. And so why would I need to know so quickly about my iron level?
Well, the idea, I think, is to be able to be more proactive about your health and monitor these things yourself. So if you wanted to get your vitamin D levels tested, for example, right now, they might do that once a year at your annual physical. They may not actually test you at all.
Yeah.
So, 33% on average of young women are deficient in iron and don't know it. Upwards of 70% of Americans, particularly in Northeast states, are deficient in vitamin D and don't know it. There's a real knowledge gap here, which is exacerbated by the fact that nobody's getting tested. So if you can test yourself, you can sort of take control of your own health and take actions to correct it.
It's true. I mean, I really feel like there's a lot of stuff in the news lately about vitamin D deficiency and things like that. But it's like, how do I get tested for this? And then what do I do? So what kinds of health complications can testing for vitamin levels help mitigate or help prevent?
Yeah. So a lot of the issue with vitamins that makes them so interesting from this perspective is a lot of vitamins will be asymptomatic. If you're deficient in vitamin B12, for example, you probably won't have any indication of that unless you're very, very deficient. Later in life, that can lead to cognitive issues, increased risk of dementia, increased risk of Alzheimer's. But by the time those risk factors appear, it's too late. What you want to do is detect these things early enough that you can mitigate it. But if you have no symptoms and you have no easy way of testing, you just don't know to look for it.
Okay, so this is going to help make vitamin testing, I guess, more ubiquitous everywhere. So how inexpensive is this? Talk to me about how this helps change the cost around this.
Yeah, sure. So we're designing this around lateral flow technology, which is effectively the same as a home pregnancy test, and can be made at the same cost as a home pregnancy test. So existing tests for these things can be $30, $40, $50. The test that we're making, the machine can be made for under $100. The individual tests can be made very cheaply. You can buy it for $5 off the shelf at Walgreens once we're onto market, and you test whenever you feel like it.
Okay, so instead of $40 and having to go to my doctor and getting a blood panel done and then waiting weeks, I can actually just use this. I can do it myself, and it costs $5 for the test.
Right, exactly. You don't have to deal with your insurance company
or
your doctor.
The answer right away.
And you can test for the things that you care about when you care about testing for them.
Very cool.
Yeah, so for certain people, women who are hoping to become pregnant might want to test for folate. They might not be tested for folate as often as they'd like to. You can take control of that, for example.
All right, so there's a lot of vitamins and minerals out there, right? So what are you testing for? What's your panel like right now, and what's the future for it?
Yeah, so our first product that we're hoping to launch is for iron deficiency testing. There are a lot of reasons for that, but iron deficiency levels in the US and particularly around the world are very high. So that seems like the right target to start with. From there, we're going to branch out to some of the letter vitamins, vitamin A, vitamin B12, vitamin D. Deficiencies vary in various countries, but they're all very high. About a third of people worldwide are deficient in one of the things that I just listed.
Oh my gosh, okay, so in the greater, I guess, health impact there is what? We're just not as well as we could be?
Yeah, it depends on the level of deficiency, but for some people, very serious complications very early on. For some people, you're just going to be tired, and you're not going to know why you're tired. And if your iron levels were higher, you'd be much happier and healthier, and you just don't know to look for it. And I think that affects a lot of people, and they just don't know that they should be testing, and they don't have an easy way to do it.
Yeah, and that's a really easy way, I guess, for them too, to be able to kind of find other things like, how do I get more iron in my diet or whatever, so that they can help kind of take care of those symptoms.
Right, exactly. It's easy to buy vitamins off the shelf. A lot of people still aren't doing it, but there's this knowledge gap where you don't know if the vitamins you're buying are actually doing anything. Right. And what we're hoping to do is give people the ability to see what they're doing is actually making a difference, and to change if what they're doing isn't making a difference.
That is awesome. So if anybody wants to learn more about your solution, about the company that you guys are running, so talk to me about where you're at. Are you guys manufacturing this yet, or where are you at from a startup standpoint?
Yeah, so we're still in development. We have a working prototype. We're doing some pilot studies with some local hospitals and the Cornell University Medical Center up in the Upper East Side. We're looking to start clinical trials relatively soon. We do have to get through the FDA. So as of right now, we're basically prepping for clinical trials, and then hopefully we can get this to market in about 2 years.
Awesome. Well, thank you so much for joining us. If anybody wants to learn more, what's your website?
VitaScan.me, M-E.
All right, VitaScan.me. This is Jessica DaMassa with WTF Health. Thanks so much for joining us.